Alien hand syndrome. Alien hand syndrome is a rare neurological condition characterized by the loss of control over one hand, which acts autonomously, seemingly independent of the individual's conscious will, often stemming from damage to the brain's corpus callosum, which disrupts communication between hemispheres. AHS manifests as the affected hand engaging in purposeful or disruptive behaviors without the person's intention or awareness. Individuals with AHS may experience frustration and confusion as they perceive their hand as having a mind of its own, leading to challenges in restraining or controlling its actions. Treatment typically involves managing underlying neurological conditions and employing therapeutic strategies to cope with and mitigate symptoms. Cotard syndrome. A disorder exists wherein individuals affected perceive themselves as deceased, non-existent, or devoid of internal organs, sometimes termed walking corpse syndrome or Cotard syndrome. Those afflicted often endure profound depression accompanied by delusions, primarily characterized by an intense conviction that they, or parts of their body, are decomposing or absent. Some individuals may perceive a loss of their soul or essential vitality. Actions such as disposing of possessions, cessation of eating and drinking, or self-injury, often without sensation of pain, may be undertaken to validate their perceived non-existence. Some may even develop a sense of immortality, while others may disengage from relationships, believing themselves or their loved ones to be unreal. Bulimia nervosa. Bulimia nervosa manifests in episodes of binge eating, wherein individuals consume large quantities of food within a short span, feeling a loss of control over their eating behavior. Following a binge, they experience intense feelings of guilt, shame, and disgust regarding their eating habits and body image. To cope with these emotions and the fear of weight gain, individuals with bulimia engage in purging behaviors, such as self-induced vomiting, misuse of laxatives, or excessive exercise. This disorder consumes their thoughts, emotions, and relationships, leaving them feeling isolated, ashamed, and overwhelmed. Oppositional defiant disorder. Oppositional defiant disorder primarily affects children, characterized by a consistent pattern of uncooperative, defiant, and hostile behavior directed towards peers, parents, teachers, and other authority figures. These behaviors often cause more concern to others than to the children themselves. For instance, a simple request from a parent, such as tidying their room, might elicit an immediate and rude reaction, possibly accompanied by stomping of feet. This response isn't merely about being difficult. It feels almost reflexive, like a rebel without a pause button. It goes beyond challenging rules. It encompasses an entire mindset, a way of engaging with the world marked by defiance, stubbornness, and a continual refusal to conform. Olfactory reference syndrome. Individuals afflicted with this condition hold a steadfast belief that they emit a repugnant odor, despite lacking any evidence to support it. This conviction triggers intense worry and distress, prompting them to engage in repetitive behaviors such as excessive bathing or avoidance of social situations. They may incessantly check themselves for any hint of odor, frequently shower or change clothes, and excessively use perfumes or deodorants to conceal the imagined smell. This fear of being judged or mocked due to their perceived odor can lead individuals with olfactory reference syndrome to withdraw from social interactions, resulting in feelings of isolation and loneliness. Fregoli Delusion. This condition involves individuals maintaining a delusional belief that various individuals are actually one person who changes their appearance or disguises themselves. Those experiencing this delusion perceive everyone they encounter as one individual, assuming different identities. For instance, they may mistake a stranger for a familiar friend in disguise, or perceive multiple individuals as manifestations of the same person altering their appearance. Those afflicted with the folie à deux delusion often attribute harmful intentions to the perceived singular person, believing them to be plotting against them. They may view people they know as mere actors playing roles. This delusional conviction breeds intense suspicion towards others, compelling them to constantly seek evidence to validate their belief. Body dysmorphic disorder. Body dysmorphic disorder, BDD, is characterized by an overwhelming preoccupation with imagined flaws or minor imperfections in one's appearance, which are typically insignificant to others. Individuals with BDD excessively concentrate on specific aspects of their appearance, such as their skin, hair, nose, weight, or body shape, convinced that these features are flawed or abnormal. Mirrors become both a source of torment and a continual reminder of their perceived ugliness. They may devote hours to scrutinizing their appearance, engaging in rituals to conceal or correct these perceived flaws, and unfavorably comparing themselves to others. Munchausen Syndrome. Munchausen Syndrome entails an individual repeatedly and intentionally portraying themselves as afflicted by physical or mental ailments, despite not being ill in reality. Those with this condition fabricate or embellish illnesses, undergoing numerous tests, procedures, and hospitalizations in pursuit of the attention typically accorded to the sick. This often involves exhaustive research into medical conditions and treatments, leading to anxiety and distress when their feigned illness is scrutinized. Paradoxically, they find relief and gratification in garnering medical attention and sympathy, even if it necessitates unnecessary medical interventions and poses potential harm to their health. Agoraphobia. Agoraphobia is an anxiety disorder characterized by an intense fear of being in situations where escape might be challenging or where assistance is not readily available. Individuals with agoraphobia commonly dread and avoid scenarios such as public transportation, enclosed spaces like movie theaters, and open areas like parking lots or bridges. This fear stems from concerns about experiencing panic-like or embarrassing symptoms while in these settings. Those with agoraphobia may worry about their ability to exit easily or obtain help if symptoms arise, leading them to steer clear of situations where escape appears difficult. In severe cases, individuals may become completely unable to leave their home. Borderline personality disorder. This mental health condition entails challenges with regulating emotions, controlling impulses, and managing personal relationships. Individuals affected by this disorder frequently experience intense emotions that fluctuate frequently, often cycling rapidly between feelings of sadness, anger, emptiness, and anxiety. Minor triggers can evoke disproportionately strong emotional responses. Impulsive behaviors are common among those diagnosed with this disorder, manifesting in actions such as reckless spending, substance abuse, binge eating, and even self-harm. These impulsive acts often serve as coping mechanisms to cope with distressing emotions. Diogenes Syndrome. Diogenes Syndrome predominantly affects older adults, particularly older men. Its main manifestations include excessive hoarding, living in squalid conditions, and neglecting personal hygiene. Those with Diogenes Syndrome typically isolate themselves from society, often living alone and oblivious to the disorderliness of their living environment and their lack of self-care. They exhibit severe self-neglect regarding hygiene and appearance, appearing unkempt with overgrown fingernails, soiled clothing, and greasy hair. They show a lack of shame or regard for social norms, engaging in behaviors such as urinating or defecating indiscriminately within their home, or remaining unclothed. Paradoxically, their home serves as both a sanctuary and a confinement, where possessions accumulate unchecked and basic cleanliness is disregarded. Rooms become inundated with newspapers, refuse, and belongings stacked to hazardous heights, creating an overwhelming and perilous atmosphere. Trichotillomania. This condition involves frequent, repetitive, and uncontrollable urges to pull out hair from the scalp, eyebrows, or other parts of the body. Individuals affected by this disorder may attempt to resist these urges, but find themselves unable to stop. While occasional plucking of stray eyebrows or pulling of split ends is common, for those with trichotillomania, hair removal becomes excessive, often resulting in noticeable bald patches on the scalp or eyebrows. Those affected may experience a tingling or itching sensation before succumbing to the urge to pull. Some describe entering a trance-like state while engaging in the hair removal ritual. These urges and subsequent hair pulling can occur during times of both stress and boredom. Dissociative identity disorder. This condition occurs when an individual possesses multiple distinct personalities within the same body, typically as a coping mechanism for trauma. Picture having various versions of yourself that take turns interacting with the world. Interestingly, once you regain control, you have no memory of what your other personalities did. Those affected often experience memory gaps between these distinct personality states and may feel as if they've been taken over by other identities. These alternate identities, referred to as alters, can vary in age, gender, personality traits, and voices. Transitions between alters are often triggered by psychological stress, and the person may switch rapidly between identities, sometimes in a matter of seconds. Derealization disorder. This condition manifests when individuals frequently experience a sensation of observing themselves from outside of their body, or perceive their surroundings as unreal, or both. They may feel as though they are living in a dream, describing sensations of feeling detached from their own emotions, senses, and identities. This can result in feeling foggy, dreamlike, or as if they are merely going through the motions of living. This sense of detachment may also extend to friends and family, who may appear unfamiliar. When looking in the mirror, they may sense that the person staring back at them isn't quite themselves, or they may perceive events happening around them as if they are not actively participating, similar to watching a TV show, instead of fully engaging in the moment. Dissociative amnesia. Dissociative amnesia goes beyond simple forgetfulness. It involves experiencing gaps in memory, akin to missing pieces of a puzzle from one's life. Individuals with dissociative amnesia encounter an inability to recollect significant personal information, often linked to traumatic or stressful events. They undergo sudden and unforeseen memory loss, which may entail forgetting specific events, periods, or even personal details such as their identity. These memory lapses typically arise from severe emotional trauma, leading the mind to employ a protective mechanism. Unconsciously blocking out traumatic memories serves as a coping strategy to manage overwhelming emotional pain. Dermatillomania. Dermatillomania entails being ensnared in an unyielding cycle of compulsion and shame. Picture feeling an irresistible urge to pick at your skin, whether it's a blemish, scab, or imperfection, despite knowing that doing so will cause damage and potentially lead to scarring. The face, arms, and hands are typically the areas most frequently picked at, although any part of the body can be affected. Skin picking often occurs in response to negative emotions, stress, or boredom, and can offer a temporary sense of relief or satisfaction. Individuals with dermatillomania may engage in prolonged periods of skin picking without being fully aware of it, and attempts to cease the behavior are often unsuccessful. The cycle of picking and subsequent healing can result in physical discomfort, skin infections, and lasting scars, exacerbating feelings of distress and shame. Erotomania. Erotomania represents a type of behavioral disorder where an individual harbors an unfounded belief that someone else is in love with them. Past case studies suggest that social media platforms may exacerbate these delusional beliefs. Erotomania creates a world where reality becomes entangled with fantasy, blurring the boundaries between admiration and obsession. Those affected by this disorder firmly believe that someone, often a public figure or individual of higher status, is deeply enamored with them, despite little or no evidence supporting this notion. Individuals with erotomania may interpret innocent gestures or chance encounters as confirmation of the other person's undying love, leading to persistent efforts to establish contact, declarations of affection, or even stalking behavior, despite the absence of reciprocal feelings from the object of their affection. This can result in intense emotional fluctuations, heightening their delusional beliefs. Hypochondria. Imagine the challenge of living with an unrelenting, overwhelming fear of having a severe medical condition, despite receiving reassurance from doctors and negative test results. Every minor ache, pain, or bodily sensation becomes a cause for alarm, triggering numerous catastrophic thoughts about potential illnesses or diseases. This heightened paranoia and anxiety often result in frequent doctor visits, extensive medical tests, and an ongoing need for reassurance, which offers only temporary relief. Individuals with hypochondria commonly misinterpret minor body symptoms and sensations as indications of serious diseases, even when medical evaluations yield no evidence. Examples include interpreting a headache as a brain tumor or perceiving a small mole as skin cancer.